It's really important, people, that we have people like you. Because in the governance in the board area, it's the feedback, it's the comments that comes from communities that then formulates policies, aligns with the policy of the Ministry of Health. Taking the leadership role, he's the chair of the Pacific Advisory Committee for the Auckland District Health Board, the pastor Alfred. Now let's give him a very big hand.
Great to have everybody here. My name is Alfred Mutuakoringaro. It encourages that today is also a reflection on the stories for our Pacific people in regards to our journey here to New Zealand, our life in New Zealand, our sense of our dreams and our aspirations, because we came here with a vision that we would succeed. For the most of us, it didn't quite work out. And so what we became, in one sense, is still the labourers working for the dream. That we want success look like for the Auckland District Health Board if it was meeting its needs for our Pacific community. The reply that we gave back was this, that for our Pacific people, we want the same things that every other person wants. We do want better health outcomes, opportunities for employment, opportunities for commerce and for business. How do we need to make sure that we actually get our people involved in those areas? As a health board, what do we need to change in our thinking? In the system, who do we need to include around some of the decision making, and who decides what are the outputs and the outcomes and the measures of success?
In the position that I hold, I find that hard without your help. But the thing that came was the cultural insight that worked out that the best entry point for people in the Pacific origin when you want to transform health is through the thing they most feel affiliated to, which is their village church.
It's wonderful to see lots of familiar faces. I know that in the work that we've done over the last year, more that we could do to improve the health of our Pacific people. And whilst we have Healthy Village Action Zones, which is based within the church, we also recognise that we are also part of the bigger community. The Auckland DHB Pacific population is the second highest of any DHB in New Zealand. And obviously across the wider region of Auckland we make up 30%. So
there are currently now 42 churches who are involved in Healthy Village Action Zones, and with each one of them they're all very different, even though some of them are Congregational, Presbyterian, Methodist. Each one of them has a different structure and they have different leadership, and so we have put a lot of the funding initially into the team, and this includes 5 parish community nurses, community health workers, and also a coordinator and a nutritionist. But it also involves the PHOs. I think the key role was to begin with the parish community nurses and done an assessment of the health needs of their community, and that includes things like housing and social needs. So they will link in with WINS, they will link in with Housing New Zealand.
We haven't often enough listened to the people to whom we should be serving. We offer manaakitanga from the institution to the population. The challenge you put up there in terms of Pacific workforce. Let me just tell you one little thing we're doing. In the area of Tamaki in Auckland, and Glenninnes and Panmure, we're deciding to actually invite women who are currently on the domestic purposes benefit, who are Pacific and Māori, to actually be put through nursing courses. 200 women. I want to commit today and tonight our institution to be in service of the agendas that you raise. And that's quite a difficult thing for an institution to do. Well, the agenda that you have set out tonight becomes part of the strategic plan of our organisation. This is to empower your Pacific Health Advisory Committee on your behalf to have the mandate and authority to say, we need this. And for us as a DHB to be humble enough and smart enough to say, fair enough, let's find the resource.
Today is about starting the conversation or starting listening, because as Pat said, we have to write our strategic plan for the next 5 years, the next 10 years, and actually make that difference, and we will do.